everybody. Good morning. I just wanted to cover a few things. We're getting into the season of all the questions, and it's kidding season coming up. And I've noticed there are a lot of people who don't have a lot of experience, and they're asking questions. And so I wanted to go over some real basic things, what to have on hand. I feel like before you even own goats, but really find someone that you can work with. If you have somebody who has been doing goats for a long time, like I said, I've learned all this stuff the hard way. So nobody had videos for me to watch when I was starting out, and I learned all this by reading. I have that really great book called Goat Medicine, and then also just from veterinary care. Every time I've called a vet or gone to the veterinary clinic, I always ask a lot of questions. I find out the real answer. I find out why they're doing what they're doing. I just constantly, like last night, I was reading my goat book again because I wanted to refresh my memory on this stuff, and discovered something else totally non-related that I realized I didn't know. So you're gonna always keep learning. You should always listen to a vet when they offer advice. And so we're gonna go over some basic vitals, and then a basic. Well, my basic kit is probably a little bit more than what normal people's are for a first aid kit. But what I want to stress to everyone watching this is if you have goats or you know someone who has goats, please make sure they establish a relationship with a veterinarian prior to anything happening. So once a year, I always call a veterinarian, my vet, but I'm actually looking at switching veterinarians to a new vet, and so he needs to have a client relationship with me. So I'm not going to have an emergency. I'm just going to call him for a regular ranch visit on, a nice day whenever he has time, and have him come over and look at all my goats and walk around my property and tell me, what he thinks. Have him look at a couple goats just real quickly. And that is considered building your client doctor relationship. That's all you need to do. Just call the vet ahead of time, have them come out. It might be a ranch call, $60 to $100 or whatever the ranch call is. But the ability then to call that vet and talk to them over the phone and have him get drugs for you is probably going to save your goat's life. Like I said, build a relationship with a veterinarian before an emergency. We don't want to lose goats. We don't want to feel like, oh, I wish I could have this or that. Just have a vet out, build a relationship, and then they can get you meds. Most everything now, even simple antibiotics, are prescription only. So, you're going to want to have those things on hand right away, not have to wait. So here's our goat vitals, our temp, our pulse rate. Respiration for an adult should be a little slower than a kid. Heat cycles, 18 to 23 days. My alpines run right around 21 days, pretty steady. Breeding season for our normal, and when I say Swiss, I also include La Manchas in there. Any standard size breed that's not a Nubian or a Nigerian typically will follow the July to February breeding. Gestation 145 to 160. I've heard some Nigerian people say that their 90s go a little bit closer to 140, but I'm not sure about that. So let's take a look at some goats. So a healthy goat, when you walk up to them, should be like this. Inquisitive, checking you out. Got one chewing her cud, two chewing cud. Everybody's looking. Ears are up, heads are up. Ears are the big key. Can be a little harder with Nubians, but there is still the eyes. They should be bright-eyed. There should be no, when you see a goat with its hair puffed up, I don't know if you've ever seen that. That's a real bad sign, usually indicates that they have a fever or pain of some kind. So see this goat, she's really curious. This is what we want to see, bright eyes, the nose is clear, the eyes are clear, the ears are erect. This goat here in the back is chewing her cud, which is great, we want to see that. Oh, here's another one chewing her cud. She's looking a little more relaxed, but she's still alert. The ears are moving, the eyes are moving. Nobody's got any hair puffed up. I have a doe back here who's struggling a little bit with she's starting to have problems with, not quite ketosis yet because I'm catching it, but she's very heavy bred and she's got probably triplets that are pretty large. And so I'm just really watching her. So a lot of goat management is just coming out here for 5 minutes, 10 minutes, and watching your goats do what they do. See how she just rocked her legs there a little bit? That's not normal. That indicates that she's having a little discomfort in that back end on her feet. She's heavy with kids. You need to build a relationship with your own herd. So first you build a relationship with your vet, and then you build a relationship with your herd. Because like everybody in this pen, I know them. And this doe here, this red doe, she's always kind of quiet and off by herself. So, you know, if I see her kind of quiet and off by herself, it's not that big of a deal, but I will go make her get up. Okay, so don't ever just assume, oh, because that's how she normally is, that she's okay. So just take 5 minutes, 10 minutes, and observe your goats. So we need to build a relationship with our vet, we need to build a relationship with our goats so that we know what normal is. And then you, as the producer, can really tell when they start to go off, even just a little bit. Like, I know my goats really well, and I know exactly when something's starting to change. And I don't know how to tell that to people, but you'll know it when you see it. Okay, so now let's talk a little bit about products. There's a lot of things that I have here that you cannot get without a vet. But like I said, I've been raising goats for over 15 years and I've established a good relationship with my veterinarian, and I'm pretty much able to get whatever I need. And like I said, I want to have all this is stuff that I may not even use in a whole year, but I want to have it because when you need it, you don't want to be running around or calling somebody. Let's just go over a few things real quick. The first tool of diagnostics is so important, and I see so many people who don't have this item or don't. The first thing you should do when a goat is off at all is take that temperature. We need a rectal temp. You can use lube. I do what most veterinarians do, and I just spit on it and then put it in the rectum. I have 2 digital thermometers that I keep by my milk stand, plus my good trusty mercury veterinary thermometer with a string. I use this tool right here. I use more than anything, anywhere, at any time, ever. And so what you do if you have a goat you suspect may be off or feeling a little down, take her temp, but then take her herd mate or somebody else right in that same group. Typically what I do, because I'm typically milking my goats, so I bring them out. So if I have a goat that I think is off, I'll take her temp and then I'll take the next 2 or 3 goats that come out for milking. So there's the thermometer is really, really important. Something else that I use a lot, so once we know if her temperature is okay, but she still maybe doesn't look right, a stethoscope. This was the best investment. I mean, it's $8. This was the best thing I've ever bought for helping to just make sure that you're not missing something. Because if you're looking at your goat, like I said, and she looks a little off and maybe the breathing isn't right, so we need to check her lungs. Okay, so you want to have that. If you do call a veterinarian, the first thing they're going to ask you is what's the goat's temperature. They may ask you what her respiration is. They may ask you, is she lethargic? Well, that means, that she's not getting up and moving around. Some other things to have on hand that are handy, a wound product of some kind. I just recently started using AlgaShield, but there's lots of other things. Blue coat works just fine. Now remember with blue coat that it is a bit caustic to the skin, and so you don't really want to use that like on an udder or around the eyes or mouth or anything like that. This wound powder dust is good for like a weepy, deep wound that you need to kind of soak up stuff, and it's more of a, this is more of like I use it for like lacerations. It says right here it's a blood coagulant, so it's really good for those gnarly cuts that are just kind of, you need to stop the blood. So it's a powder, you shake it into the wound, and then you can put gauze onto it. Something else that you should always have around, alcohol. I use it for everything. Prepping skin, prepping teats, checking, wiping off my thermometer after I use it. Lots of alcohol. I buy alcohol in a gallon jugs, and then I just refill these little things. Coming into kidding season, you're going to want to have some calcium on hand, calcium gluconate, and I believe now that this is even script, but I'm not sure. But anyway, calcium gluconate can be given orally, can be given sub-Q, can be given IV. Dextrose is a good thing, and sugar. So it's just straight sugar. You can be giving it IV, but I mainly use this either orally or sub-Q. You have to be careful with giving dextrose sub-Q because it can cause, it burns, so I use it mainly orally. Activated charcoal, really good to have on hand, especially if you live in an area with toxic plants, or your goats are in more of a forage situation, because my goats are pretty much dry lotted, so if they needed charcoal, it would be more because they got into too much grain or chicken food or some random thing like that, not poisoning. But activated charcoal, good to have on hand. Another tool that I've had for years and years and years, and I love, is my mortar and pestle. Great for grinding up pills to give orally, like sometimes you'll need to give sulfa tablets orally, and it's just easier to crush those things, mix it into some water, and then drench it. And that leads me to my next product, which is these drench guns. I have a 30cc one, and then I also have 100. This one's great for like does when if they're going ketonic, or you really need to get a bunch of cc's of fluid into them. The 100 is really good. I just recently bought that. This is now a prescription drug too. This is something labeled for pigs, but it can be really helpful for baby kids if they get E. coli scours as young kids. This stuff works really good for E. coli. So if you're having a kid with nasty diarrhea and you don't, most of the time we don't know why, but if you give this product and it goes away, you're most likely chasing E. coli or some other bacteria. So good to have on hand. I don't really use this much, but like I said, I want to have it. Now leading into kidding, we're going to need something for the navel. I just recently started using this Super 7 product. It's really great. I love it. Dries the navels out really quick. It's in a spray bottle, so I just hold the kid like against my body, and I hang them so that their navel's hanging down, and I just spray it, and it's so amazing. Dries it out fast, easy to apply. I can't recommend this product enough. I just love it. So now let's look a little bit over here. Oh, some more kidding supplies. would be, you want to have on hand. We don't ever really want to go into a doe, but if you do, you should have some uterine boluses on hand to put in after you go in. So like if you have to go in with your hands to fish out a kid, you should, once you confirm that there's no more kids in the uterus, you put 1 or 2 of these boluses into your hand and go back in and place it as far down into the uterine horn as you can. And this will just help prevent infection. It's not really an antibiotic. It's just it's an antiseptic. It's not an antibiotic, but it says it has urea in it. Okay, something else good to have on hand, ophthalmic gel, and then also some sort of a spray. Like I like the Vetricin pink eye spray. It's really good for washing out debris. But this gel is really good stuff too because it's thicker, so it kind of like really soothes the eyeball if it gets an abrasion. Probios. I like dispersible powder because it's so much easier to work with. It dissolves really quickly in milk or water, and so what I do a lot of times, I'll mix it with water and maybe Karo syrup, or you can mix it with calcium gluconate, or you can mix it with whatever, and then use one of your drench guns here and administer it orally that way. And they like the taste of it. It's really good stuff. Some of my goats will actually eat it in the powder form. And then looking a little bit down further into our med kit, we've got a bloat treatment. I've never used this one, but like I said, you want to have it. Also, a good bloat treatment is olive oil or corn oil. You want to use an oil that has a flavor. You're not going to want to use mineral oil orally. You can use mineral oil if you're going to tube the animal, but do not use mineral oil orally because they can't taste it and they can they can inhale it, and then you've got a whole nother problem besides bloat. Then you've got pneumonia. B complex, which you can get over the counter still. If you can't get thiamine, this is okay, but it's just not the same. I highly recommend that everyone, if you're going to make a short list of things that you really just want to get from your vet, thiamine would be high on my list. So thiamine, a good antibiotic, a good broad spectrum antibiotic, and then thiamine. Back here we've got biomycin. It doesn't burn like LA200 will. Biomycin is okay. It's good for things like pink eye, pneumonia, things like that. It's not really the best drug to go to for like uterine infections and mastitis and things like that, unless you know what bacteria you're chasing. But for more of a broad spectrum kind of a thing like, oh, I've got a goat with a fever and maybe she's having a little bit of snotty nose, this would be a good thing. I have other things. I have hormones and drugs and things back in here. Something I added to my kit that I never had before until I had a reaction is now I have epinephrine in my med box because I had a goat have a anaphylactic reaction to an injection and I didn't have the epinephrine, so now I have it. Now I'll probably never have to use it, but I have it. Also something that I have, and I don't really use it much, but I have it in here, is just some lubricating jelly for your thermometer. Let's see. And then you're going to have to get things like penicillin from your vet. But I do have a bottle of that in my fridge. Brand new, never opened because we don't really use penicillin very much. But like I said, and then something else that is, and I'm glad I found these because they're on manufacturer back order, but the Clostridium antitoxin type C and D. Now this is not tetanus antitoxin, and this is not the CD&T vaccine. These are all different things. But this is the C and D antitoxin. This is vital if you have a kid that's showing signs of floppy kid, or even an adult that's showing signs of enterotoxemia. And so something that you should definitely have in your refrigerator because it is an emergency situation drug. Time is critical on this one, and if you don't have it, it's not going to help. So have that in your fridge. Here is the regular bottle of Clostridium tetanus. So this is what we call CD&T vaccine. And I don't have a bottle of tetanus because I actually used it. But anyway, so a few other things I have is just a little baggie of probios that I carry with me. Milk sample tubes, a Sharpie, needles, some syringes. Most of this stuff is stuff that you really don't ever want to have to use, but when you need it, you're gonna want it. One thing I didn't cover is this guy. Milk of magnesia. Great for if your does are having any kind of acidosis or rumen upset. Anyway, we've gone way over time today, but I just wanted to touch on some of the basics. So just remember your vitals for your goats. Our temps should be 101 to 103.5. Obviously, if it's cold, could be a little bit lower, but anything under 100 should be very troublesome. If they're even 100 or below, I'd be a bit concerned. Low temp is actually more dangerous in a goat than high temp, but definitely we don't want fevers either. And then check our pulse rate, check our respiration. Is that rumen moving? You should be able to feel it move or see it every 1 to 1.5 times per minute. So go out, have a cup of coffee, and enjoy your goats, and look at what they're doing normally so that you can catch things before they become too severe. And if you like this video, please subscribe. Check out all my other videos. They kind of all answer questions from one to another. So have great goating, guys.